Well, is there a doctor in the house? Well, technically, yes. We're hanging out with Jackie, who's the owner of Fountain Valley Healthcare, a local clinic here in Fountain Valley area. Jackie, thank you so much for being here with us today.
Thanks for having me.
All right, run me through. You guys are completely local. What does that mean for your business?
Yeah, so I grew up here, graduated from Mesa Ridge, just up the street, and then this clinic where we're at was my primary care clinic when I was a kid.
Oh, no way.
Yeah. So the doctor that we bought the building from was who I saw when I was little. So it's kind of come full circle. But yeah, we stepped out from kind of corporate healthcare, like trying to make it more about the patients and quality care rather than quantity of patients we're seeing. And it's been 3 years now. Doing okay so far.
Good. Okay, when you say local clinic, are you still able to do things that other clinics that have big corporations behind them, are you still able to do those same things here?
Yes, we can do anything a regular clinic would do. We're set up to be able to do chronic care management, so diabetes, high blood pressure, that sort of thing, acute illnesses, cough, cold, runny nose, annual physicals, well-child checks, so we see all ages, little to big. And we're set up with most insurances, so we do take Medicaid, which is a large base of our patient population, but we also take Medicare and most private insurances too.
But the big advantage here is that you're local, right?
Yes.
Talk about how you have an advantage in this area.
Yeah, so we're pretty familiar with our resources, so we know most of the time who we can send you to if we need to get cardiology involved or, a physical therapist. We know where they're located because they're usually the same places we're going to. I can tell you which pharmacy not to use. If you want to wait in line for a few hours, we can send your meds there, but we know some little more local, little better places to go. And then the other side of that is that we have longer appointment times. So we're not as rushed, with some places where it's like you can only pick one problem, and that's all we're talking about today.
Well, and I bet the staff here too is super cool as well.
Yes, we have, so there's 5 of us now as far as nurse practitioners. So we have 3 primary care. We have 2 of us that are psych mental health nurse practitioners. And then we have 2 therapists on staff as well. And then we have our full staff of our medical assistants, our admin people, and we have a case manager as well, Jason. That's kind of fabulous. He helps a lot with some of the social needs that our patients have.
Well, what does it mean to you because you grew up here, what does it mean to you to come back and provide medical service for this area?
Yeah, I love it. Actually, I've had patients that I've gone to school with now that are patients here.
Oh.
I've been able to help with some of the stuff that we've done some school physicals through District 2 and been able to set that up so that they can get their sports physicals. And us being smaller like that, it allows us more flexibility and to kind of be able to do what we think is the right thing or what's best for the community.
And the response must have been pretty big too.
It was, yeah. We ended up seeing 180 patients in one day. It was a lot between 3 of us. So.
Because how long have you been open so far?
Since 2022.
Wow, so a newer business then.
Yes, yep.
I love that. Is there anything that you would say to people who are watching and, might not have known about you because you're new? What would you say to get them down here?
Yeah, I would say the whole point about coming here is that we're trying to build a relationship. We want to get to know our patients. We want to know your family. I have a lot of people that we see their babies and then the parents start to come here because they're like, oh, okay, we really liked how you treated our kid or, that sort of thing. So the nice part is it's kind of one-stop shopping in that sense. The other thing too is that we try to treat the whole person. We're not just going, okay, here's your diabetes medicine, have a nice day. We're screening for mental health issues as well, which are a huge impact in the chronic care management, and so we're fully integrated. So you don't have to go somewhere else. If you're struggling with substance use, we can help with that too. We do MAT services for alcohol and opiate use as well. And we have therapists on staff that we can get you set up with if you need counseling and that too.
Well, Jackie, thank you for your service and thank you for your time right here at Fountain Valley Healthcare. A lot of dedication to keeping Fountain Valley healthy. Hey, if you missed any of our other features on our Fountain Valley stories, make sure to tune in to our special this weekend too. All right, this segment has been sponsored by Fountain Valley Healthcare.